Terry.
And Katie.
Today we're going to do another update. This is our third week update, so we're kind of getting ready to go through all the procedures. So this one's going to be just kind of an update of what we know and what we know we're facing, because we've pretty much had all of the introductory meetings and appointments, and now we know what we're facing and what we're going through and kind of the procedure and step-by-step that we have to follow. But first, let's talk about Katie's hair. As you can see, she has cut her hair off. She said in the last one that she was going to get a haircut, but now it's all short. Get ready for her chemo treatment, so it's kind of a transition. She wanted it shorter, and I always told her to cut it short. She always followed me on it because she didn't want to get it short, but now she talks about how much she loves it and how she likes it short. So
no, I'm gonna keep it this way when it grows back.
yeah, I told her all the time cut it short, but no. She's also fighting me on the type of shirt I'm wearing for this video. This is what I chose to wear today. Go Gamecocks. But now let's talk. So first, let's talk about the type of cancer we know that Katie has. She'll kind of tell you a little bit about it.
So earlier I told you that I have invasive ductal carcinoma, and we now also know for sure that my cancer is a triple negative cancer, meaning it does not respond to estrogen or progesterone. They test the receptors on the cells, and they also do a HER2 test. So my cancer will not respond to hormone therapy, and they'll hit it a little bit harder with chemo first.
And I think one time I mentioned the FISH test, and that was to check out the HER2, because they already knew that she was negative for the first two, the two hormones, and they did the FISH test, which took a little bit longer to find out, which they kind of thought that she was, because it seems like everybody that already has the first two is going to be triple negative anyway, or a majority. But so they did that. So now we know the triple negative, which is the fastest growing, and she was the stage or the type 3 or whatnot that was fastest growing. So that's why we're kind of going the process that we're doing, which is chemo first and then surgery, and we're having to go through all this process and all these different meetings early and fast to get this started. So we went to a genetics counselor and got all that information, and she learned a lot about that, which Julianne, her sister's already a genetic counselor, so we knew a lot about that already. But she met with those. You want to talk a little bit about what they told you there, what to expect from that?
They're going to look specifically for the BRCA1 and BRCA2 gene mutations, as well as TP53. I would be most likely to have the BRCA1 mutation if it is genetic. A lot of people know of those genes because of Angelina Jolie. She tested positive for those mutations, and the chances of having a breast cancer or ovarian cancer with the BRCA genes is much higher. So that will really dictate a lot of surgery options in the future. It will kind of help us to make decisions about biological children. They can test for that now, because if I do carry a genetic mutation, we would be 50% likely to pass that down to our children.
And one reason we're going with the genetic counselor, getting all that, is because she is only 28 with breast cancer, and I think that might be a sign that she might carry the gene, being that she is young and had breast cancer at a young age. So that's why we went through the genetic counselor and doing all that testing. But after genetics, then we went to fertility. We've been giving her shots at 9:30 at night all week, starting last weekend after our first fertility test, our first fertility appointment. Every morning, going to get a
An
ultrasound,
every
blood
other
work
day.
every other day, 3 days last week. Going again tomorrow. So that's on point.
They think I'll be ready for our egg retrieval on Wednesday. Looking good there.
Yeah. So next update, we'll tell you if we have anything working in there. So fertility is up and going. Almost done with that. Next is oncology, which we have another appointment next week for oncology, and the port is coming in next week, and then we'll probably get started with that the following week. So we have an idea of the treatment path for that as well, for oncology and chemo.
Yeah. Looks like chemo is going to start on June 30th. I will have 4 cycles of adriamycin. That's the first drug I'll be getting. That will be every other week, and my oncologist is going to give me an extra week of recovery the first cycle so that I can go on vacation. And after I finish that drug, I will be on Taxol every week for 12 weeks.
Yep. And then surgery, which we will be meeting with the surgeon as we start chemo and get further along in that process, and we know more about the genetics, which that takes about 2 weeks for us to get the genetic results, and So the surgery's down the road later in the year, but so right now we're gonna start the chemo in the next couple weeks, get that going. Fertility's gonna be finished. For chemo, we're gonna do a lot of fun things. I got her a couple of adult fun language coloring books that she's looking forward to, so we'll have to show you those and give you a little more information on that. But
And about some hats.
bought some hats to get ready for the chemo because the chemo drugs is gonna knock her hair out. That was one of the first things the doctor told her. So she's been preparing for that. We're getting her hats, making her hats, getting everything ready for that. So moving right along. I think,
We'll keep you updated this week.
yeah, that's the update for now. We know pretty much everything as far as the procedure, and now we're just gonna start soldering on. Put on my Guarded Army shirt. Well, thanks for watching, and we'll keep you updated.
Bye.
Goodbye.